Hey guys, welcome to part 2 of our pain section around myths around laser. So in the first one, part 1, we covered, we just reviewed what different types of pain there are and how they obviously work. So now I want to actually bring in the laser side of things and how does laser actually help with our different types of pain. So what's really interesting, you know, when we talk about pain or laser, we kind of group it into, yeah, it helps with pain, inflammation, tissue repair. But actually there's a lot more that is happening, and we are affecting those 3 different types of pain, which I think is quite cool, because there's not many things out there that do affect all of the different types of pain, because obviously they can cross over sometimes. So I'm just going to run through the elements of photobiomodulation that actually affect pain. There's lots of other things that are happening at the same time, so don't judge me for not going through the whole of what's happening with PBMT, but again, just wanting to link it specifically to our pain management. So the first thing is we increase serotonin. Serotonin enhances mood and enhances well-being. So from a first off, that psychogenic pain, we're starting to have an impact there. We increase our beta endorphins, and beta endorphins, this reduces production of GABA and increases dopamine, which causes pleasure in the brain. What's really interesting as well, so we can see, you know, as the beta endorphins increase, GABA decreases, again, feeling great. But when it comes to morphine, what we actually see is it reduces beta endorphins, which can lead to drug tolerance withdrawal. So it's why we see some problems with morphine use. We also have ACE. So ACE is increased. It's an inhibitory neurotransmitter. So when we're looking at neuropathic pain, it's shown to increase activity of the ACE receptors in damaged muscle, and it increases the increase in ACE decreases the discharge frequency of excited neurons and increase inhibitory neurons. So, for example, with my face condition that I talked about in the last video, my nerves are firing too often. And that's what's kind of telling my brain it's painful. So with our laser, it's going to help reduce that discharge of those really excited neurons, so that everything just kind of calms down that little bit. It's also been shown to reduce cyclooxygenase 2 and bradykinin production. And obviously our bradykinins induce pain by stimulating afferent nociceptors, which is that soup that we kind of mentioned. So it stimulates all those inflammatory mediators there. And the cytokines and growth factors that have anti-inflammatory, antioxidative and anti-apoptic properties are then increased as well. It also reduces the production of inflammatory markers, so interleukin-1 beta, tumour necrosis factor alpha, and prostaglandin E2 is reduced. And we see an increase in hypoxic cells, which are obviously damaged cells, nitric oxide, which is increased. So NO is a good neurotransmitter, and it's a good chemical messenger. When we get an increase at the site of injury, it blocks mitochondrial production of ATP and oxygen binding to our CCO, or cytochrome C oxidase. And as cytochrome C oxidase is a key photoreceptor, which is you'll hear us talk about quite a lot as a target for our laser therapy. Once stimulation occurs, our nitric oxide becomes unbound, so it's released, and it allows then for an increase in cell metabolism. I can never say this word either, metabolism. I always struggle with that word. And obviously then we have unbound nitric oxide, and that helps to work to relax smooth muscles, which increases vasodilation and oxygenation, which is obviously what we want in areas of poor perfusion. As an increase in obviously with that circulation, it removes those inflammatory mediators by flushing those out as well, all from that site of injury or that site where we're treating. Our unbound nitric oxide has also been shown to inhibit sensory afferents in that peripheral nerves and activate endorphin release. So again, helping with our psychogenic pain there as well. And then nerve cell regeneration is also increased. So again, when we've got those damaged nerves, by helping to sprout new axons and repairing damaged cells as well. You know, with allodynia and neuropathic pain, they're amplified with nerve cell injury. So if we can help with those, then that's great. And ultimately, you know, PBMT, it helps to decrease neutrophils in our joint fluid. That's helping relieve pain, increase that joint mobility and function. We decrease the inflammation in tendons and ligaments while increasing tensile strength. That's also important, because not only are we helping with the pain, we're also helping with those, you know, those tendons, ligaments that when they become weak, we get that weakness in the joint, and then obviously we get pain there. Collagen fibril size, fibroblast production. You know, there's tons and tons of things that are helping, that indirectly, you know, help with our pain management as well. So lots going on. Just want to kind of just go back to our 3 types of pain again. So just to kind of really be clear where laser helps with those different types of pain. So with our normal pain transmission, we have that transduction, transmission, modulation and perception stage. So with that transduction, that increase in nitric oxide, inhibition of peripheral nociceptors, decrease that COX-2 and therefore PGE2. With that transmission side, we're decreasing mitochondrial membrane potential in DRG. We decrease release of pro-inflammatory neuropeptides, increase nerve cell potential, and block depolarization of those slow C fibers that, again, that more chronic pain that we see. For our modulation phase, we increase beta endorphins, and for that perception phase, increase serotonin and endorphins as well. There's great papers on all of those elements as well. So if anyone's interested, please feel free to message me and I can send you links to those papers that kind of talk about all those elements. Specifically mentioning neuropathic pain as well. Again, that nerve cell regeneration, it's helping sprout those axons, repairing damaged cells, and helping to reduce that nerve cell injury, neuropathic pain. And again, as ACE is increased and is an inhibitory transmitter, neurotransmitter I should say, it's shown to increase activity of ACE receptors in damaged muscle. And increase in ACE decreases the discharge frequency of excited neurons. Whew, that was a long one. And then finally, again, that psychogenic pain, increasing serotonin, increasing those beta endorphins, and unbound nitric oxide, again, is going to help activate endorphin release there as well. So that is a lot to take in. I hope that all kind of made sense, because I know pain isn't straightforward generally anyway, and then add laser in and there's lots to think about. So when you next talk about your laser, obviously a lot of owners aren't necessarily going to understand all of that, but actually try thinking about ways in which you can use your laser for pain management that maybe you wouldn't necessarily think about. Can we use our laser in patients that maybe are having some psychogenic pain and secondary issues there? Have you thought about using your laser for your neuropathic pain? We again very classically use it for arthritis management and chronic OA pain, but have you used it in your neuropathic cases as well? So lots to think about. I hope that helps make sense, like I say, and helps make pain seem a little bit more straightforward. So enjoy that. Next video, I'll try and focus around tissue repair. It may be a week or 2 before I get that one to you, as I'm actually off on holiday next week, which I'm really excited for. You may see a couple of posts. But again, if there's anything you guys want to know, any questions you have, then feel free to reach out, and we'll catch you all soon.